The term walking pneumonia is one that is applied to usually a more milder form of pneumonia. And so I think the term walking pneumonia comes from the fact that usually people with this infection are well enough to kind of be up and about even though they have an infection going on at the time. Generally, walking pneumonia is caused by a type of bacteria that we classify as an atypical type of bacteria. And in this part of the world, most commonly that is a bacteria called Mycoplasma pneumonia. When we talk about pneumonia, we're referring to an infection in the lungs. Pneumonia can be caused by both bacteria and viruses, and in rare cases, fungi as well. But when we talk about pneumonia, we're really referring to an infection of the lung tissue. So symptoms of walking pneumonia are similar to symptoms of pneumonia in general, but generally are on the milder side. So in a child or person with this infection, that can look like cough, fever, runny nose, some difficulty with breathing, occasionally chest pain or some shortness of breath as well. So if you think you might have walking pneumonia or any type of pneumonia, it's a good idea to see your physician or your primary care provider. They will really be the best ones to do a physical examination and potentially order a chest x-ray if they think that one is warranted to determine whether you might have pneumonia or not. Sometimes it's difficult just from looking at a patient and listening to their chest to know for sure. So in those situations, it's helpful to get a picture of the lungs to see whether there's any area of infection that's visible.